So hi guys, today I'm coming with a new topic which is called benign prostatic hyperplasia. Benign prostatic hyperplasia is a very common disease which means preponderance which occurs above 50 years of age. So in this video we are going to see in detailed explanation about BPH. So let's begin. So yes, this is meant by benign prostatic hyperplasia. A benign prostatic hyperplasia is characterized by hyperplasia of both prostatic stromal and epithelial cell, which form large, fairly discrete nodule in the periurethral region of the prostate. And also, what happens that the nodules, when they become sufficiently large, they compress the narrow urethral canal, which can be seen over here. They have compressed the narrow urethral canals. The urethral canal urethra becomes slit like opening and gets positioned peripherally, and thus it causes urinary outflow obstruction to the urethra, and also urethra obstruction occurs which goes obstruction to urinary outflow. Now we will see the etiology and pathogenesis. Known as the most common disease in male after 50 years of age, what happens exactly that since years testosterone is being metabolized. Now by the action of type 2 alpha demethylase, testosterone will be converted to dihydrotestosterone. This dihydrotestosterone will act on both stromal cell layer as well as the lining epithelial cell layer. This dihydrotestosterone will go and bind to androgen receptor. Now, this androgen receptor binding affinity to dihydrotestosterone is even more powerful than its binding affinity to normal androgen. This will cause activation of androgen receptor genes. Now, this androgen receptor genes activation will lead to stimulation of stromal cells to release fibroblastic growth factor 7, which will cause stromal cell hyperplasia, that is proliferation, and also release 5GF1 and 5GF2, which will cause fibroblastic proliferation. Now the same process takes place over here in the lining epithelial cell. It goes bind, but remember that epithelial cell proliferation does not take place. Instead, the already senescent epithelial cells which need to undergo cell death, this process is hampered because of the attachment of dihydrotestosterone to androgen receptor. Because of this, senescent cell death does not occur and senescent cells remain, which in fact increases the epithelial cell count. So count is increased because of this. This is how the exact thing occur, and then they will cause the urethral obstruction, bladder obstruction, which will cause obstruction to urinary outflow. And then we see the symptoms of BPH like increased urination, urge for frequent urination, and difficulty in urination. These are the things which we see as a symptoms of classic symptoms and signs of BPH. Now we will go for the gross and microscopic features. So yes guys, now let's start with morphology. Morphology, we have gross morphology and microscopy. Gross, will first discuss the external surface. Weight of the prostate is increased about 6 to 8 times. Site is the most common site is submucosa of the periurethral and the lateral lobes of the both sides. And also what are the consequences because of urethra becomes slit like peripherally due to compression of the nodular region. And also medium lobe hyperplasia is observed when the hemispherical nodule over the base compress the base of the urethra. So as seen in this diagram, the consequences, key nodules which have created a slit like urethral opening at the end and it has been pushed towards periphery. Now next is The cut section. Cut section consists of well circumscribed tumor which are not capsulated and compress the surrounding prosthetic tissue. So you can see over here there is a compression of surrounding prosthetic tissue. Surrounding prosthetic tissue is compressed, and also we can find a plane of cleavage between the nodules and a normal prosthetic tissue. There is a plane of cleavage between the nodule and the normal prosthetic tissue. So basically, what are the variations? In variations, we have two type of variations. First variation is a nodule with predominant glands. If the glands are there, it will yellowish white nodules with soft consistency, and then more thing will be there, which is honeycomb like appearance will be observed. Honeycomb like appearance. And also nodule with fibromuscular stroma. Since it's fibro and muscular, therefore it will have a hard consistency, and also there will be a grey pale nodule. But since there is a gland, there will be secretions, therefore it is a yellowish white nodule. Also one more difference, it oozes the prosthetic fluid when it is pressed, and it does not cause oozing of the prosthetic fluid. After completing the gloss, let's come to microscopy. Microscopic characteristic feature is presence of nodules. What is the composition of nodule? We have epithelial component, we have duct and acini. Let's see diagrammatically. So this is the basically microscopic feature of benign prostatic hyperplasia. We have three components as explained over here. We have epithelial cell component, we have smooth muscle cells, and we have stromal fibroblasts. So basically these nodules are the characteristic features. You can see the nodules which are the characteristic feature of benign prostatic hyperplasia. First let's discover the epithelial component. Epithelial component are arranged in the form of a ducts or acini. So yes, those are arranged in the form of a ducts and acini. More precisely see in this diagram, the epithelial components are arranged in the form of a ducts and acini. Inside epithelial cell component is lined by a tall columnar cell and outside by flattened epithelium. So flattened epithelium outside and inside by tall columnar cells. Also what we observe is there is a papillary projection into the glands or lumen. So this is the papillary projection or finger-like projection, as one can observe over here. So this is the lumen, and in the lumen has a papillary projection. So this is the lumen, white color is the lumen, and inside the lumen the finger-like projection you are observing, those are the papillary projection characteristic. Also we find corpora amylexia. Corpora amylexia is actually what? It is the eosinophilic laminated concretions which are commonly seen within the acini. So eosinophilic concretions commonly seen within the acini are called as corpora amylexia. Next thing commonly seen is the smooth muscle cells, as you can see over here, and stromal fibroblasts. These fibroblasts are of 5 types. So we can see this fibroblast over present. So 5 types of fibroblast. We have fibrous, we have stromal fibroblast, in which we have 5 types: fibrous, fibromuscular, muscular, fibroadenomatous, and myoadenomatous being the most common one, and this is what we discussed earlier. Then there are other findings also: areas of lymphocytic infiltration, areas of infarction, and areas of squamous metaplasia around the infarction. And the last part to be discussed is complications. So what are the complications of nodular hyperplasia, also known as benign prostatic hyperplasia? So in complications we have basically hypertrophy of bladder. Why hypertrophy of bladder occurs? Because there is a compression of prostatic urethra and results in bladder outlet obstruction, because of which there is a hypertrophy of bladder. Obstruction usually flows, and bladder hypertrophy, retention of urine, and trabeculation of bladder may develop diverticula. Next is infection, because inability to empty the bladder may lead to residual urine in the bladder liable for infection like cystitis, and ascending infection हो गया तो pyelonephritis. And the thing is key consequences of obstruction: prolonged severe obstruction with back pressure results in hydroureter and hydronephrosis, and ultimately death due to renal failure. So yes guys, this were the basic things and most important things about benign prostatic hyperplasia. A lot of efforts has been put, a lot of time has been taken in order to make this video a reality, a genuine help from my side to everyone trying to understand the basic pathology behind benign prostatic hyperplasia. Previous two videos were actually microbiology videos, and I hope they helped as well, but this is the first pathology video which I am posting, and I hope it takes you to a deep ocean of knowledge. Yes, and with diagrammatic retrospect of notes as well as diagrammatic view. Yes, thank you so much for your patience and patience and very patient learning, basically listening. And I hope you enjoy the video and get a lot of knowledge from it. Thank you so much from this side.